Okay, hello everyone. Thank you for joining us. This live session is part of FIT's Decoding Pain series, where we look at the different aspects of pain, what it is, how it manifests, and the different treatment options. So I'm Anushka from FIT, and today I'm joined with Dr. Dhruv Bibra. He is a pain management specialist working with Delhi Pain Management Center, and he's here to answer your pain related questions that you've been sending in to us in the last couple of weeks. If you're watching us on YouTube or Facebook and would like to ask him a question, please do so via the comment section. Good evening, Dr. Bibra. Thank you so much for joining us.
Good evening. Thank you for welcoming me, inviting me. Thank you so much.
We can wait for a couple of minutes for people to join. I have all the questions with me, and like I said, these are questions that people sent in to us and would like answers from you about pain, managing pain, treating pain. So whenever you're ready, we can get right into it and begin.
Sure, no problem. You can start anytime, whenever you're comfortable.
Right. Okay, so I think let's just get into the first question, because the first question I think is a good place to begin, because I think it'll kind of summarize everything for us. So Shireen asks, what is pain? Is pain real? How do you differentiate between psychological and physical pain?
Now, this is a very interesting question. Shireen, I would like you to ask, I don't know whether you're married or you have somebody in your families. You ask a female going into labor pain, whether is she having pain or is she faking it. You ask a person who meets with an accident, is he, once he has a fractured bone, so does he has pain or is he faking it? Pain is very real. Pain has a lot of hidden cost, which we sometimes tend to ignore. Now, these are all examples of acute pain where you can see the pathology. Now, things become challenging when it is a chronic pain, which has become a part of the life of a person for a very long time. In those subset of patients, though they appear to be normal, but still the hard facts where their personal, professional, interpersonal relations all are compromised because of that pain. They are the people who actually describe pain in a very complete and a holistic way. Regarding the psychological pain and real pain, so there is nothing like a psychological pain or a real pain. The pain is pain. It has got an emotional aspect as well as the physical aspect to it. And whenever we are talking or whenever we are taking care of our patients, or whenever we are assessing the patients, we need to take care of both the pains. Now, it can be there can be two conditions, like one condition where the patient is having pain which has led to psychological manifestations because of a compromised lifestyle. So you have pain leading to psychological manifestations. So that is a larger subset of patients. You have a minor subset of patients where the patient is having some psychological issues, and because of which the patient manifests as pain. So pain is always real. Nobody can fake pain.
Right. So Shireen has one more question, and I think this kind of ties to her first question. She asks, I've had a constant undiagnosed headache for 3 years. She says she's had X-rays, MRIs, CT scans, and they've all come back normal. So what could be a possible cause for this?
Shireen, I could guess it. See, the thing is with headaches, now we tend to divide headaches into two broad classifications. One is a primary headache and another is a secondary headache. Now, secondary, if you look, just hear the word, the name is self-explanatory. It means that this headache is because of some underlying pathology. For example, some infection, some tumor, some sort of a trauma. And for all those things, you have already gone all the tests done. So what I can say, just by the brief history or the brief line that I have heard, is that you suffer basically from primary pain. Now, primary pain are again classified. There's a big classification, but broadly speaking, there are like migraine, like tension type headache, like cluster headache. Now, these are pure conditions. These are conditions which are diagnosed just based on your history. Okay, so what I would like you to go approach is a neurologist or a pain physician who can take a detailed history, and from that history itself, we will come to the diagnosis that what type of primary headache do you suffer from, and then you can be managed.
Right. Before I jump into the next question, for everyone who's just joined us, I'm here with Dr. Dhruv Bibra. He's a pain management specialist with Delhi Pain Management Center, and he's here to answer all your pain related questions. So, if you have any questions for him and you're watching us on YouTube or Facebook, please do send in your question via the comment section. The next question is from Meera, and she asks, is there a way to manage pain without painkillers or medication? How effective are alternative treatments for pain relief? So these are two separate questions, but
Okay, so I'll take it one by one. See, the thing
yeah.
is, Meera, thank you so much for the question. See, I practice modern pain, medicine. So, where we have what we call it as a holistic management and a multidisciplinary approach towards pain. So, it has medicines, it has physical therapy, it has got interventional techniques, and even if required, there are psychological interventions also. So, everything has a part to play. And sometimes even we have to go for a surgical option. So what I would like to say is that you cannot have, whenever we are trying to get a plan a management for a patient, it has to be multidisciplinary as well as multimodal to get the best result possible. So if you remove one of them, then your management will be incomplete, and the effects and the results may be a bit dodgy, or may not be the way that we want to. But you are right. And I will also like to add to it that pain medicine or pain management is just beyond painkillers. We do use painkillers, but there is a rationale behind it. And secondly, it is time bound. It is not that indefinitely I would put somebody on painkillers. So that is why what I said, that it is entire bouquet of techniques what we utilize when we are looking for a complete and a holistic improvement in pain condition. Regarding the second thing, regarding alternatives medicines, because I have got limited experience with those factors, I cannot comment about it. But what definitely works is something what we call as physical therapy or physiotherapy, then functional therapy. Now, functional therapy is how do you manage a patient's life, day-to-day activities. Then there are psychological interventions. Then there are conditions which have not been proved to be according to the modern medicine, as I told you, according to those standards. Therefore, I cannot promote and comment about them because I am not doing or using all of them. But yes, definitely physical therapy, psychological therapies, and psychological interventions are being used and very effective when we are out there to manage our patients.
Right. And what about therapies like acupuncture, which are in the spectrum of towards the holistic and ancient traditional type of therapy, but is also accepted in modern
See, the thing is, see the I we live in the what you say era of evidence-based medicine. I'll give you an example where everybody will understand. Now, everybody is going through a COVID pandemic, so every vaccine that comes out, the first thing we ask is what is the efficacy. Now, that efficacy will comes out from a last case studies based on thousands of patients, and that will give us an efficacy. So now that is the basic standard that we follow in all our medical practices. Fine. Based on that, there are few studies and few clinical conditions where acupressure and acupuncture have shown some sort of a result, but those are limited clinical conditions where they have effect. So, but what I would just like to tell the viewers is that we have gone beyond it. Okay, so acupressure, for example, acupuncture. Now, acupuncture was a primitive thing. We were just putting in needles. Now, what we have started doing is now there are a couple of things like dry needling and wet needling and ultrasound guided needling, where the basic principle remains the same. Only thing we have added a couple of more technologies to make it foolproof and to increase our efficacy.
Okay, so the next question is something that I'm sure a lot of people would like the answer to, especially those of us who have been working desk jobs from home during the pandemic. So Jashan asks, is there anything like simple exercises or at-home treatments that can help with back and neck pain other than just fixing your posture? So, yeah.
Now, this is a very interesting question. It is something somebody asking me that doc, I want to reduce weight, but I can't stop eating. The point with that is that you have to understand. See, the thing is, why are you having this pain? Now, that pain is being caused because of bad posture. So, my friend, you have to work on your posture. And once you have worked on your posture, then we will start with exercise. Exercise definitely have a role in managing pain, both less in treatment but more in prevention. So for example, if you have an acute episode, you should not exercise. Let the acute episode settle down, then start with your exercise so that you do not have a next attack. But at the same time, we have to attack the root cause. Now, to attack the root cause is the posture. So it is very simple. So you have to work on your posture. There are two simple rules which I always tell all my patients is there are two curves of the body. One is the neck and other is the back. Now these are which develop later in life when you have neck holding and when you become erect. Whatever you are doing, pleasure or work, make sure that these are well protected. That is rule number one. Second thing is make sure that every 10 to 15 minutes you are changing your posture. Just simple getting up from the table, from the chair, shuffling your weight, that is good enough. Just follow these golden rules and life will be sorted.
Thank you, Doctor, for that. The next one is a slightly long question, so just bear with me on that. Nitin says, I have played volleyball for more than a decade. I started experiencing pain in my shoulder while smashing the ball 3 years ago. All the doctors I met said there wasn't any problem even after taking X-ray and MRI scans. I've had to stop playing volleyball now, a sport that I loved so much due to persistent pain. I would like to know what could be causing it and what could help treat it. So,
Okay, fine. Now, before I start, now sports person are a very special, very gentle, and very close to my heart when I treat them. See, the thing is, what happens is that because they are into a very physically demanding job, and that is one. Secondly, to be what should I say? To get the best out of them, they almost go to an extent where they are using more than 100% of their body. They go into postures which are not so ergonomically designed for our body. For example, a body is not suited to get into those positions, but because their sports demands them, they get into that position. Fine. So they are prone to injuries. So injury is a part of a sports person's life. So for my dear friend, when he plays volleyball, he has to smash. So probably he's pulled something in his shoulder. Now, what happens is, if I had scans, I would have been more precise. But I can give him a journal overview. So how we can help him is that there are certain newer techniques of regenerative medicine. Most commonly used is a PRP-based therapy, where we can use his own platelet-rich plasma and inject into the damaged site. Now, how do we come to know about the damaged sites? Now, there are a couple of things. One, he mentioned about the MRI. So that is one where we can scan the MRI. The other thing is there is an MSK ultrasound, an ultrasound technology which is specific for the musculoskeletal system, where we can diagnose it, and at the same time we can target that area and do certain interventions for him to get better. But yes, there is hope. That is what I would like to tell. And if he had shared his scan, I could have been more precise. But yes, we can take care of his pain.
So once again, I would just like to reintroduce you for anyone who's joined us recently. This is Dr. Dhruv Bibra, and he is a pain management specialist. He works with Delhi Pain Management Center, and he's here answering your questions about pain, managing pain, how to treat any pain that you have. So if you have any questions for him, do put them down in the comment section and we shall pick them up. The next question is, can dietary changes help with treating migraines?
Yes, definitely. They have a definite role. Now, we have a comprehensive list of things now that are based on the literature that we have. And also, we have added a few things based on the patient experience that we had. So what are basically those things? The golden rule is that you should not be empty stomach for more than 4 hours. So you should always snack on something so that you do not go empty stomach. That is one. Second thing is we need to avoid the C's: chips, cola, coffee, chocolate. Now, cola means any carbonated drinks. Fine. Then smoked fish and raw onions. Now, and sometimes groundnuts also. Now, these are the few dietary things which you need to avoid if you have a tendency of having migrainous attacks. So these are the few things. But I would like to just add that these are based on generalizations, so may not be a trigger for everybody, but these are the most common triggers. So just for people who have a different list, it is absolutely fine. You should have your list and make sure that you follow it. But one golden rule that you need to follow, that everybody needs to follow, is that you should not be empty stomach for more than 4 hours.
So just expanding that question a little bit, are there any dietary restrictions or additions to your diet that can help with chronic pain of other kinds? Like, does your diet affect, chronic pain?
Yes. See, the thing is, there are few nutritional deficiencies which predispose us to a lot of chronic pain. Most common is vitamin D deficiency, which is rampant. I would say it is almost endemic in our part of the world. And it is shameful because we live in a country where we have sun almost 350 days. So one is vitamin D levels, especially with our indoor and more of these indoor activities, especially during the pandemic. So that is one, vitamin D. Then multivitamin deficiency can also be complex deficiencies. These are the two major deficiencies which can definitely contribute to that. That is one. Second thing is lack of water. So if your water intake or liquid intake is not appropriate, then again you are more prone to tough muscles, more prone to spasms, more prone to posture related, especially those muscles which are working during your posture, sitting and standing. They are more prone towards getting spasms and stiff. So water intake and nutritional deficiencies, these are two a couple of things which you definitely need to work on. Now then there are few things which are not to 100% proof, but there are certain things which cause, certain diets which cause a lot of inflammation in the body, which predispose patients to chronic pain, especially people who have chronic pain and they are suffering from a very long time. For them, these are basic. There are also some, like for example, gluten, lactose. Now that is a very special subset of patients where they act as pathogens or irritants, which will just make your patient suffer from pain, and they will increase their pain and spread it to, say, abdominal organs also. So otherwise, nutritional deficiency, vitamin D deficiency, calcium deficiency in old population, and B complex deficiencies, and water intake, these are four most common things that we come across in our day-to-day practice about for patients, for which the patients have vague dull aching pain all over their body.
Right. Again, the next question is slightly long. I have extreme pain in my lower back and abdomen when I'm on my period. I showed it to a doctor who asked me to get some blood tests and an ultrasound done, but they were all normal. Then I was prescribed painkillers again and asked to take them on my period, but they don't provide any relief either. What could be causing this? Is there any treatment or home remedy that can help? Now, there's another question as well along the same lines about treating painful menstrual cramps and what to do when painkillers don't work. And also, is it safe to take painkillers when you're on your period?
Okay, first things first. It is safe to have painkillers during your periods. Normally these kind of pains are spasmodic in nature, so you need to make sure that whatever painkiller you are having has an anti-spasmodic or a muscle relaxant action, which is actually going to help you during that time. Okay, so for that 3-4 days, an antispasmodic NSAIDs with the regular painkillers with a muscle relaxant is good enough and should give you relief. But if it is constant and it is beyond that time, then probably we need to get you investigated and actually try to find out what is causing that pain. Sometimes hormonal disturbances can cause, very rarely some nerve disturbances can also cause it.
Right. Yeah, and I think extremely painful periods is something that a lot of people go through, and sometimes it can also be endometriosis or other kinds of
Yes.
issues like that. But it can be really difficult to diagnose them as well. Like the first question said, investigations a lot of the times don't bring out anything. So
Yeah. So see, endometriosis again will come out in some sort of an investigation. Okay. Now the rare causes are when it goes beyond because see, the thing is, every women's menstrual cycle is different, and the amount of pain and the hormones all are different. So therefore, the pain will be different. But if it goes beyond it and it starts hampering their day-to-day work, then it's the time where we need to get it thoroughly investigated and examined and try to find out what is the probable cause.
um, So the next question is from Priyanka. She says, "I've been diagnosed with RLS, which is restless leg syndrome. Even with medication, my leg hurts. I never get a good night's sleep, and there aren't any. Are there any remedies before sleep that could relieve my pain?" She also asked if there are any specific foods that she should include in her diet. So we come back to the diet
Okay,
part.
fine. Now, RLS is a very interesting disease because, as with most chronic pain conditions, it is not diagnosed by it doesn't it is not diagnosed by any sort of investigations. Okay, so that is one. So it is basically a clinical diagnosis. That is, and it is also a diagnosis of exclusion. What I mean by exclusion means that all your tests will be done, and then they will come to a diagnosis. Since everything is normal and you have a typical calf pain which is more while you are lying down or when you are trying to sleep, so it is diagnosed as RLS. Now with RLS, because it is not a very straightforward diagnosis, therefore the treatment is slightly challenging. There are two basic set of drug groups which are given. That is one. I don't know, because since Priyanka is not, if I am not getting her name correct wrong, so Priyanka must, if she could have shared what kind of drugs that she has been given, so we could have discussed what are the other options that we can go for her. That is one. Secondly, she talks about, then there are certain interventions also which we can do. There are certain IV injections which we can give for 3-4 days in extreme cases of RLS. That is one. Third, very important point which she talked about was whether nutritional deficiency also can cause something like RLS. Yes, there are studies which proves that, especially in patients who have iron deficiency, they can have RLS. A very strong correlation is found between iron deficiency as RLS. Therefore, what I will strongly recommend her is not to just go for iron. There is something which is called as iron profile. So there are a set of 5 to 10 investigations which she needs to undergo. Therefore, we will be able to find out what is the level of iron and what is the efficiency of the iron that is working in her body. That will definitely give us a clue, and if there is she is deficient, then iron supplementation will help us take care of her RLS.
So before I go to the next question, we had one question come in about fibromyalgia. It says, "Doctor, why does it get so difficult to diagnose fibromyalgia?"
I'll tell you a small saying. A mind can, a eye can see what your mind knows. So if your mind doesn't know, your eye can't see. The same goes with fibromyalgia. Now, fibromyalgia is a classical chronic pain condition which is extremely common. To give you in perspective, sorry, we do not have our numbers, but if I have to quote Western literature, it is around 7 to 10%. So just imagine, you must be knowing around, and again, it is more common in females. So 90% females and 10% males. So just imagine that if you know 100 females, around 7 or 8 of out of them have this disease. Okay. So why is it difficult? Now, this is a challenge not only with fibromyalgia, but with every primary chronic condition where all the investigations are normal. So there is no investigations, quote unquote, lab and imaging, which will prove that you have a fibromyalgia. So you will never have a patient who will have something coming out from a lab report or a scan which says that the patient is suffering from fibromyalgia. It is a clinical diagnosis, but it is a real disease. So how do we diagnose this? There are a set of questionnaires which the patient is supposed to answer, and based on that, we diagnose the patient of fibromyalgia. Now, why is it difficult? The point is because they look exactly the same like you and me. For example, if the patient is having a disc issue, he will limp to my OPD chamber. But in cases of fibromyalgia, the person will walk comfortably and sit with me. Now that becomes, and with fibromyalgia, there are two kind of days. There are very bad days, and then there are not so bad days. So what happens is one day the patient is absolutely fine doing almost everything with difficulty, but next day the patient pain is so severe that the patient is not able to get out of bed. Now that becomes baffling for the family. And to add to the confusion, all the investigations are coming normal. So you have a patient who is functional, who has good days and bad days. Then the investigations are normal. Multiple doctors are being consulted. Nothing is coming out of it. And because, as we started, you will recall we talked about the psychological aspect. And because she is in pain for such a long time, psychologically she's all messed up. So she has. So what the people try to label it, that he or she he has awful temper. Whenever he wants to do work, he does work. Otherwise, he will always say that I have got pains. So that is why it is very difficult. So that is why, just to add a bit about it, the first and the foremost important thing when I treat, or what is the basis of treatment, is patient education and the education of the people who are handling her. That yes, he or she suffers from that pain, and it is a real condition. It is not something which is a sort of an what do you say, an imagined condition. And thank you so much for this question.
Right. So the next question again ties up with Priyanka's earlier question. She asks, does smoking or drinking worsen RLS? And also, I would just like to add to that and ask, does it affect other chronic pains as well? Will it aggravate?
See, being a doctor, I can't promote it. So it is bad for your health. It is bad for your health. Okay, so I cannot say that, okay, if you drink, nothing is going to. No, it's not good. It's not with pain or without pain, but no, it doesn't. Though I would just like to add that there are few conditions where it is directly, what you say, cause and an effect kind of a situation. For example, if you have a tobacco use, so you are predisposed, you are compromising the blood supply of your disc, the intervertebral disc, the spinal disc that we have. So later you are just predisposing to it to degeneration. That is one. Second thing is, there are certain conditions where arteries can be blocked, which will predispose you to severe vascular pain. Okay, so these are the few conditions. But yes, so at this point, I can't say that they have a causal effect with RLS, but at the same time, I can't promote that you can have drinks and smoking. Both are injurious to health.
Right. Since we were just talking about diet, there's another question that's come in. What are the diet tips for people suffering from joint pain due to high uric acid levels? What are the foods to avoid?
See, the thing is, when you are doing for uric acid, you need to avoid red meat. So basically, red meat and whole pulses. So red meat and whole pulses like rajma, chole, chane, sabat moong, sabat masoor, all those things you need to avoid. Along with that, when it comes down to vegetable, peas, spinach, cabbage, brinjal, you need to avoid for at least when you have an acute attack. And drink lots and lots of water.
So once again, I would just like to tell everyone, if you have any questions, to put them in the comment section on YouTube and Facebook. So we have another one that's just come in. What steps should one take to get the right diagnosis? I guess they're talking about pain in general or chronic pain.
Okay, so see, the thing is, now this makes me go down my memory lane. The first year of my college, see, that was the time when the quest for finding the right diagnosis actually starts. See, the thing is, whenever we come to a diagnosis, we follow the basic principle of medicine, not pain medicine, but medicine. And what is that? That is history. The most important thing for the right diagnosis is history. And especially when it comes down to pain medicine or pain conditions, the most important thing is history. And as we have, you must have seen during our discussion that the thing is that we have to have a detailed history, and based on that history we come to a provisional diagnosis, and then we order investigations, and once we have ordered investigations, then we have the final management plan. But apart from that, just taking that history, talking to the patient, and for the patients to explain their pain conditions in detail. Don't try to now one more thing, I think we are almost at the end. One more thing is that there are some social aspects also attached with pain. Now I will request everybody not to justify pain by their age old tradition, like अब मैं बुढ़ा हो गया हूं मुझे दर्द हो रहा है, नहीं, I had a fall 10 years back and now it is this is the cause of pain. No, these are all things, all justifications which I hear every day, every hour, almost with every patient. No, body has a tendency of healing. So something which happened 10 years, 15 years back there, it may not be there. And you are not getting old. 40 is not old. 50 is not old. You might, so that is one thing. And secondly, there is another aspect also. People tend to undermine their pain also. Itna to hota hai. No, no pain is healthy. Every pain requires an answer. Why it is actually happening, and once we find that, we need to chase it and actually go after it and find a best possible solution which is compatible with your quality of life.
So I just have one more question that I have to ask. It's from Neera, and she says, I've been having sciatica pain for the last 7 years. Every new episode is less painful, but now the pain in my left leg and specifically foot has become persistent, and it becomes worse at night. I'm taking pregabalin 75 mg at night. What else can I do?
See, the thing is, thank you so much for the question. The thing is, I would like to, there are a lot of options that we can discuss, but the point is, I need to have a look at the MRI. So that will give us an idea. But what I can tell you is 7 years in pain is not healthy. And please do not, I cannot take any drugs name, but taking medicines indiscriminately for 7 years again is not healthy. And it is now affecting your quality of life. What I read and what I heard was that you have a sleeping disability, which is not healthy. So it has started impacting your life. If you can't sleep, your performance goes down. Okay, so please get yourself evaluated. There is a cause of pain. Whichever city you have, get hold of a doctor, get your scans, and try to find out what is causing this pain, and we can definitely help you with something or the other. But living with pain 7 years, taking medicines indiscriminately, and that pain eventually affecting your sleep and all those things is just not healthy. Please take care.
So I think we can wrap it up now. So thank you everyone who's joined us, and thank you everyone who sent in their questions. I hope you got satisfactory answers, and most of all, thank you so much, Dr. Bibra, for taking out the time, joining us, and so patiently answering all our questions. This was very enlightening. So QuintFit, like I said, is doing the Decoding Pain series all of this month. So we have more stories related to pain if you would like to check those out. In fact, we've also done a video with Dr. Bibra where he explains what pain is, how it manifests, and the different kinds of pain disorders that are there. So do check that out as well. Thanks again, Dr. Bibra. Thank you.
Thank you so much. Thank you for the invitation. Thank you so much. Bye-bye. Take care.
All right. Yeah. Bye.